Alright guys, it's Dr. Muhammad. We are back for another public health sciences question. You guys know what to do. 15 seconds on the clock. Feel free to pause the video if you need some more time, and then we'll go through it. So the correct answer in this question was choice C. Do not intubate the patient because that is his request. Hopefully you got that right, but let's go ahead and read through it and figure it out. An 89-year-old male with a past medical history of COPD presents to the hospital with his sister due to shortness of breath. The patient has audible wheezing during the interview, however he is able to speak in complete sentences and provide a full history. The provider inquires if the patient would want to be intubated if his symptoms worsen, and the patient states he would not want to be intubated under any circumstances. The patient's sister mentions that the patient's memory is not what it used to be and has a paper document showing that she is the patient's power of attorney. The patient's sister says that the patient would want to be intubated. What is the most appropriate management if the patient's condition worsens? So again, taking that 10,000 foot view as we always do, we're talking about an older patient, an older male with COPD coming in with shortness of breath. The physician asks him if he would want to be intubated if things get worse, and he says no, under no circumstances would I want to be intubated. However, his sister, who is at bedside, who has documentation showing that she is power of attorney, says yes, he would want to be intubated. His mind's been going a little bit lately and his memory is not what it used to be. So there's a disconnect between what the patient is saying and what the sister's saying, and we need to figure out what the appropriate management would be if the patient got sicker. Based on all of that, we know we're in the public health sciences section, and the reason that I like this question is because it's tying together a lot of different topics that we've touched on, right? We're talking about ethical principles, the patient's autonomy, respecting the choice to make their own decisions, but we're also talking about things like decision-making capacity, power of attorney, who gets the right to determine the patient's care. And the key determination that we need to make for this question, and for any patient for that matter, is whether or not they have decision-making capacity. That is the key thing that we need to do to be able to trust what they're saying and to have them dictate their care. Now, unfortunately, the question stem doesn't give us all of the relevant information that we would typically worry about. It doesn't talk to us about the patient's understanding of the situation, their appreciation of the situation, them expressing a choice, those kinds of things. However, we can still go ahead and make a determination about their decision-making capacity based on some key information here. So really, two key parts of this question stem is that the patient is able to speak in complete sentences and he's able to provide a full history. It's not a limited history. He's not confused. He's telling us exactly what happened. He knows that he ran out of his albuterol. He hasn't been able to refill it, and he's able to respond to all of our questions without difficulty. Included in that is when the physician asks if the patient would want to be intubated, he is able to tell us that he would not want to be intubated. So although we have some limited information with this question stem, given the fact that the patient is able to tell us why he came into the hospital, what's going on with his medications, he's able to give us a full history, he's able to respond to the physician asking about if he would want to be intubated. Based on all of that information, we should be able to determine that the patient has decision-making capacity. With that being said, let's go ahead and go through the answer choices and see how we arrived at choice C. So as we look at the answer choices, we can see that choices A and B are telling us to intubate the patient, whereas choices C and D are telling us do not intubate the patient. Just given the fact that we determine the patient has decision-making capacity, he says he would not want to be intubated, we should be able to eliminate choices A and B, and that would leave us with a 50-50 chance. But we're going to go through all the choices to make sure we understand why. Choice A, intubate the patient since the sister has a legal document indicating power of attorney. This would not be the correct answer because the patient does have decision-making capacity as we previously determined. We want to respect their autonomy. They are telling us they would not want to be intubated, so we need to listen to that. Although the sister has legal documentation showing power of attorney, given the fact that the patient still has decision-making capacity, we would go with what the patient is saying and what the patients want. That is trumping the power of attorney. If the patient came in incapacitated, or they were severely altered, or they had a known history of something like dementia, then in that case, the power of attorney would trump that, and we would be able to use the sister for decision making. However, that is not what's going on in this question. The patient is able to tell us what's going on. He has capacity. We need to respect his autonomy. We would not be listening to the sister, and we would not be intubating this patient, and that is why choice A is not the correct answer. Choice B, intubate the patient because it would then be an emergent situation. The second part of that is right. If the patient gets sicker and they need to be intubated, it would be an emergent situation. However, given the fact that when the patient was awake and alert and had capacity, he told us he would not want that, we would still take that with us when the situation becomes emergent, and we would respect the patient's wishes. So we would not want to intubate the patient even though things are getting more emergent, even though things are getting more critical, and for that reason, choice B is not the correct answer. Choice D, do not intubate the patient because his code status is unknown. This one may have tripped some of you up because, we're technically not stating the patient's code status outside of the intubation situation in this question. We don't know if he's full code, we don't know if he's do not resuscitate, we don't know if he's comfort measures only. However, the key for questions like this is when you have a patient who comes comes in and they're critically ill or there's an emergent situation and you don't know their code status, you need to assume that they're full code. Fortunately, in this question, the patient is awake and he's able to tell us that he would not want to be intubated. But if this patient were to come in much sicker, he's cyanotic, he's turning blue, his oxygen level is very low, and we don't know his code status, we would assume that he's a full code and we would intubate him in that situation. So if there's ever a question of the patient being incapacitated or there's altered mental status, we can't talk to the patient and get information from them, we try to reach out to family, we can't get any information from them regarding the patient's code status, we would treat that patient as a full code and we would do all of the things that you normally would. So although the code status isn't explicitly stated in this question because of the fact that the patient is telling us he does not want to be intubated, that is the more important thing, and that is why choice D is not the correct answer. And that leaves us with choice C, do not intubate the patient because that is his request. That is the correct answer. Again, I know I'm hammering the point home, but I want to make sure that you guys are understanding. The patient is able to tell us why he came into the hospital. He's able to tell us what's going on with his medications. He's able to give us a full history, not a limited history. The question specifically said a full history, and when he's asked about being intubated, he says no, under no circumstances would I want to be intubated. Based on all of that information, we can determine that the patient has decision-making capacity. We need to respect his autonomy. Although the sister is there with this power of attorney, we would go with what the patient wants. We have to respect their wishes first, so the patient would not be intubated because that is his request. Hopefully you got this question right. I know it may have been a little bit trickier, but when situations like this, these ethical dilemmas come up on the exam, just bear in mind you want to make sure to determine if the patient has decision-making capacity. If they do, then great. We want to respect their autonomy. We want to listen to the things that they want, things that they're telling us. If they don't, then we need to worry about things like a surrogate decision maker or a power of attorney, reaching out to family members, those kinds of things, which we've also fortunately covered in some of the public health sciences questions as well. If you have any doubts, I recommend going back to the public health sciences and watching through all of the ethics lectures. They're short and quick, but it'll give you a good overview of these topics. But that's it for now, and good luck studying.